Good morning, respected chairperson, judges, and audience. My topic of presentation is profile of victim of assault-related ocular trauma. There is no financial disclosure. Patients were given written informed consent for use of photographs and investigation reports obtained. Assaultive violence is physical force used by one person to another with an intention to cause harm, injury, or death. It is 11th leading cause of death and 5th leading cause of mortality in USA. Assaultive eye injury is more severe than other ocular injury. Aim of this study is to determine demographic profile, etiology, pattern of clinical presentation, and preventive strategy of assault-related trauma. This study is prospective hospital-based observational study, which is conducted in Rio IMS BHU Varanasi, and sample size is 60. 60 sample size is studied and followed. Patients of all age group with acute assault-related ocular trauma who are under regular follow-up for 6 months are included in this study. Ocular injury older than 1 month and treated in other hospital are excluded, and also patients who are not under follow-up under regular follow-up for 6 months are excluded from this study. All the general information is specific history are noted down, and vital examination and examination of injured part, like type and extent and severity of injury. Ocular injury like visual acuity, ocular motility, and IOP are properly examined. And most of the victims, around 80% are male, and 53% of them are 16 to 30 years of age, and most of the assault cases are noted during morning and afternoon time, and which is away from home from in 67% of cases. And most common reason is economic interest, followed by political rivalry. A most common weapon used is blunt trauma, followed by sharp object and chemical object. And physical object is most commonly used, followed by chemical and thermal and firearm. This acid attack case is treated in our hospital, BHU. There is oculofacial injury. And all type of ocular injury is common, like isolated, or it may be associated with facial or cranial injury, and it may be associated with a polytrauma. And a unilateral ocular trauma is most common. Periocular lead injury is most common. It is around 63% cases, followed by globe injury and then orbital injury. This is a case of physical assault by fist. Left orbit of the floor is fractured and soft tissue protruded in maxillary sinus. And this gunshot assault perforating injury noted in post-election time. This is assault by gunshot during robbery. There is multiple metallic foreign particles on face and cornea. This is physical assault by cycle chain. There is scleral rupture, uveal prolapse, and hyphema noted. Most of the assault-related ocular injury is severe, then moderate and mild. At the time of presentation, most of the patients have visual acuity less than 3/60. And which rarely improve after final treatment. Conclusion of this study is most of the assault-related ocular trauma is seen in young adults, and most common cause is blunt mechanical trauma. A majority of the assaultive ocular injury are severe in nature, which may lead to blindness. Prevention of assault-related injury is more difficult than other causes of eye injury. There is an urgent need to tackle the economic and social issue of rural males resulting in violence. Legislation limiting the proliferation of firearm and alcohol consumption can prevent the severe and fatal assault injury. And finally, I am very much thankful to my mentor, Dr. R.P. Maurya, who allowed me and present this topic on ocular trauma. Thank you.
So you say, is it the first presentation to your casualty, or these patients were referred to you?
No, sir, this is first presented to my hospital.
To your BHU IMS?
Yes, sir.
Okay. So you say they are more common in morning and afternoon?
Yes, sir.
And more related with alcohol intake?
Alcohol intake, yes, sir.
So do they start in the morning only?
No, sir. This is more common in...
Huh?
No, sir, it's not.
No, because in Punjab it is the other way around. They'll come at night only after assault.
basically interfight. That is more fun. I don't think because of
Yeah,
alcohol
but
it won't be.
you had a lot of people with alcohol intake, isn't it?
Yes, in our hospital there is a lot of patient came with alcohol in.
So
RPR
did
because
they test alcohol levels at presentation,
no,
or it was just a history?
not history. At the time presentation they already drunk. So
No. Do you check the blood levels,
No.
or do you do any kind of breath test, or it is just by history?
just by history, sir.
So these cases must all be medico-legal cases.
Yes, sir. Most of the cases are motor.
So how do you deal with the medico-legal implications of this?
Sir, we inform the police and then start treating patient. And then just
So all these patients were seen by you?
no, sir. This study is already conducted in my hospital by my mentor, Dr. R. Moria, and I am part of it.
You are part of that study.
Yes, sir.
So what was the final outcome about visual acuity?
So sir, in most of the cases, sir, visual acuity is less than 3/60, and final outcome is not very much improved after study. So prevention is more important in this type of.
Can you tell us what interventions were done in these patients?
Sir, like intervention, we treated this
Because
patient.
more than 50% had severe injury, isn't it?
Yes, sir.
So,
Can't do very much.
no, if there is a open globe injury or a blunt trauma case, were there any surgeries done in these cases?
If there is cornea tear or scalar repair, then we repair in emergency on emergency basis.
Or any follow-up vitrectomy or any such surgeries were done? Or were they referred?
So on emergency
Can you
basis,
go back to your slide? Initial presenting visual acuity? No. This one. Visual status
at the time presentation, sir,
Yeah.
in most cases there is less than 3/60 in
these
diagram.
29 cases,
Yes, sir.
it was 3/60. And final also was in
28.
28 cases. So what all interventions were done in these cases?
Sir, we treated and if there is, it depends on the sir, how much there is injured. If there is a tear or anything else, then we repair the tear, but improvement is not very much.
The whole detailed investigation which you have submitted to this patient, like suppose if you have done the repair the tear, then after you have repaired, whether you have followed up the patient with ultrasound to see the status of the retina,
Or any
hemorrhages,
follow-up
any
surgeries, vitrectomies were done or not?
Yes, sir. The patient is following up, sir. If some patients are also referred to other higher center.
So were they excluded from the study?
No, sir. And if after
No, but these patients followed up with you for 6 months. Because less than 6 months you have excluded.
yes, sir. More
So
than 6 months.
if they are referred
Yes, sir.
to other hospitals for
we try
any
to
further intervention,
that
Yes,
should
sir.
be within 6
wi-
months.
will they come to you
Sir,
for follow-up?
We try to contact that patient, sir. If they will come, then I include this patient in our study. I try to follow up that patient.
So this is more of an observational study.
Yes, sir.
Yeah, it's basically observational study. Sir was pointing that if you are following the patient, means what is your exclusion criteria? You said we are excluding any patient who is we are including within 6 months.
Yes,
So
sir.
6 months is a good time where you have to follow the patient properly and give the correct treatment.
Whatever
is
management
required,
we can
whatever,
do
if you
for
have to
these patients.
Refer the patient to higher center, you have to refer that during those duration only. But 6 months is a big time for any surgical treatment, if it is at all required for these traumatic eyes. So, sir was referring to those things.
So that's what I'm just wondering, that during this 6 months period where these patients were with you, what all surgeries, what all kind of surgeries were done? How many of these had foreign bodies inside? Inside the eye, intraocular foreign bodies.
All the patients are not seen by me, but there is the number of patients. I think 10 to 12% have foreign body in. Yes, sir.
Thank you.